Your Senior Source, sponsored by JenCare Senior Medical Center.
Welcome back. We are talking about something very important this morning, heart health for senior citizens. There are definitely ways to improve your heart health as you age, from exercise to eating right. And our next guest is here from JenCare Senior Medical Center with some great advice. Please help me welcome back Dr. Reginald Ross. Hello, doctor.
What's up, Malik, my man?
Good to see you. Thank you so much for being here. And thank you for coming on to talk about this really important topic, especially for senior citizens, cardiovascular disease. I want to start with what cardiovascular disease is and why are seniors at risk for developing this condition?
Sure. When we think of cardiovascular disease, I tell my patients to think about the heart as being a big muscle. And sometimes you can develop problems with the actual muscles of the heart. But sometimes you could also develop issues with the blood flow because the blood vessels, that's what takes blood, oxygen, nutrients, and all of those things to the heart. And if there's an issue with the blood flow, then certainly your overall heart capacity is going to be reduced. Seniors, unfortunately, are more at risk for the heart disease because whenever there is issues with the blood vessels, it typically happens the older we get. Imagine it's like if you have some plumbing at your house, and of course, if your pipes are not clogged with a lot of debris, the water and everything is going to flow through them. But however, if it gets clogged up with a lot of debris, if you have things going to the drain, that kind of slows it up and messes the water, in that case, being able to flow through the pipes. Well, that's the same thing that happens to the heart. If anything impedes the flow of the blood through the heart vessels, it certainly will lead to heart conditions.
Very fascinating. And I know for seniors over the age of 65, they are much more at risk for developing cardiovascular disease. But there are some ways that, we can minimize our risk. Let's talk about exercise programs. If a senior has a heart condition, what are some exercise programs you suggest?
Malik, exercise is so important for seniors, not just and to prevent heart disease, but just for their general well-being. Before anybody even starts an exercise program, we certainly recommend that they would talk to their physician. He can give them clearance, and then they could also plan some exercise program for them. And they could start off with just a general walking exercise program. Sometimes it could be walking around the track. It could even be walking through the neighborhood. As long as you're taking certain social distancing precautions and remember COVID, because we're still there. Stretching also helps, and we recommend you start maybe a little light walking before you even start stretching, just because the muscles are a little stiffer when we first start. And then even other exercises like yoga and even Pilates. It's a great source of low impact exercise for patients, elderly patients that may have heart conditions. And of course, the more exercise you do, the better you condition your heart and even your lungs.
Now, Dr. Ross, I know diet is something that's very important, not only for senior citizens, but for all of us. I struggle with it every day. But for seniors who are 65 and older and they want to be heart healthy, what are some diet recommendations you have?
Malik, let me first tell you that you are not alone in your struggle with dieting, certainly living here in South Louisiana. So that's a struggle that we all have. However, there are some things we can do to make sure that we take care of our heart. One thing we can do is eat more fruits and vegetables. Our fruits and our vegetables, they're high in nutrients and low in fat and cholesterol, which can certainly cause issues with the blood vessels in your heart. Also, foods that are high in omega-3 fatty acids, such as sardines and salmon and even trout, are really good, foods for people that want to be heart healthy. And also, whenever we think about, eating heart healthy foods, whole grains and oatmeal are also good sources of fiber, which helps to decrease the cholesterol. And something that a lot of people have to do, and it's challenging here in South Louisiana, is back off the salt. I think we eat way too much salt, certainly here in Louisiana. And whenever we eat foods with a lot of salt in it, it causes our blood pressure to go up. And when the blood pressure goes up, it forces the heart to have to work even harder, which is not a good thing. And lastly, drink lots of water. Just drink water. And the other thing that water does, a lot of people don't realize, when you drink a lot of water, it causes your belly to kind of stretch a little bit. When that happens, it kind of curbs your appetite. So you get a good way to curb your appetite without increasing your caloric intake. So drink a lot of water. That will help not only your heart, but your overall weight.
That's a great tip. I did not know that. And do you know how much water we're supposed to be drinking a day? What is it, 64 ounces?
I know I've heard people say like maybe even 8 glasses a day, which typically is about maybe a 12-ounce glass. That's a little challenging, but one thing you can do to cheat on that is when you start eating fruit that have water in it, grapes, watermelon, things like that. That's a good source of getting not only your fruits and nutrients, but also getting some water into your system.
Write that down. That's great. I'm going to pick up a watermelon later today. Dr. Ross, thank you so much for joining us this morning. Happy Mardi Gras to you as well, my good sir. And hey, if you want more information about anything we discussed today or any more topics, all you have to do is visit JenCareMed.com or give them a call at 504-323-5700. Don't forget, they have 4 locations on the West Bank, Mid-City, Metairie, and Kenner, and they have a 5th location coming soon in Gentilly.